Hi, my name is Madison Kelly, and I'm going to be presenting over nonverbal communication. So, what does nonverbal communication mean? Well, nonverbal communication is the act of communicating without using words or speaking aloud. Examples are sign language, facilitated communication, augmented, and alternative communication. Who uses nonverbal communication? People with autism spectrum disorder, or ASD for short, can have a difficult time communicating verbally. It is estimated that around 50% of ASD individuals have impairments with speech, and some ASD individuals can also have less control of their hands due to sensory issues. What nonverbal communication tools are available? So there are several nonverbal communication tools available. Augmentative and alternative communication offers many ways to communicate nonverbally. They can be as simple as communicating using images to high-tech speech generating devices, or SGD. And I just went ahead and put a little picture in there to show you what the lower tech speech or AAC devices look like, where they'll just point to something that they're trying to communicate rather than doing the SGD, which would be the clicking an icon and then it says it basically for you. Speech generating devices are available in many forms that typically resemble some sort of tablet. There are devices available to buy with software in them, or they can be downloaded as an app. One example of an app would be a Proloquo to go, for reference. There are icons on the tablet that can be pressed to indicate a want, answer, a question, or really, they can do just about anything. It just depends on the level of technology that you get. So an intervention using a speech generating device would look like a BCBA would be with the client. The first goal would be to determine a motivating operation. So typically they would give them two options, like a candy bar and a toy or something, and whichever one that the child picks would become the motivating operation. After that, the icon of what they chose would be placed on the Proloquo to go or other speech generating device, whatever it is that they decided to use. And the item would be out of reach so that the child or client or whatever age they are would have to use the icon on the pad to indicate that they wanted to have that again. So then continued, once the client engages using the icon for the MO, the icon will get smaller until it is its regular size. They will also start adding other icons in there. So typically they would start with something that just like blank icons, so that the client would have to differentiate between the item that they want and the item and like the other icons on there. So like if they clicked one that doesn't say anything, they would know, okay, I have to click this one to get the item that I want. And then they would just kind of start adding in other things like that. This is kind of more for like manding, but this would, I feel like, work for tacting as well. Yeah. Possibly. I know they can use it for intraverbal communication as well. So what happens next? After intervention, the client should be able to use their SGD for multiple occasions. They can use it with their family. They can use it if they can take it with them. They should be able to use it like in a class setting, or really any way that they would need to. It would allow the client to express their needs, which will lead to less frustration. And some of the research that I did, one of the things that the parents were talking about is just like how frustrated their child can be whenever they're nonverbal, because they're needing something and their parent isn't able to figure out what it is. So this would give them some sort of a chance to actually be able to communicate whenever they do need something, whenever they want something, whenever something hurts, you know. Better communication, which would lead to less frustration. And like I said, the client would have the tool to use to engage in man's tax, interverbal communication, and much more. In conclusion, the augmentative and alternative communication devices and speech generating devices are fundamental applications for nonverbal communication. I believe they should be implemented in case of nonverbal clients, as it would increase that client's quality of life. I do understand that there might be clients that might have a harder time with these devices. So it wouldn't necessarily be in any case, but where they can be implemented, it would be best if they were able to be. And here are a list of my references. And that is all. I appreciate you listening to my presentation, and I hope you have a great day.